Hey, welcome back to Studio 512. This is an important month. October is National Liver Cancer Awareness Month. So what better time to learn about the organ that's responsible for over 500 functions in our body? Dr. Shannon Cox is a radiation oncologist with Austin CyberKnife, and he is here to explain a little bit more. Good morning to you, Shannon.
Good morning.
Let's talk a little bit about what CyberKnife is and what CyberKnife does.
Basically, it's a very localized, almost laser-like, non-invasive way to treat cancers, and it's very, very focused, so you do less collateral damage to the normal tissues.
Because radiation therapy can be something that is really exhausting for the patients who go through it.
Yeah, we've progressed through the years to getting more and more refined, more and more focused. So sometimes now people have very little side effects, and especially with tumors that are appropriate for CyberKnife are usually smaller, very confined, and so they actually do very well. They tolerate it very well, unlike years past. Yeah.
And so how has this technology been changing over the years? It used to be a full-on radiation session. You'd have to go multiple times. What does CyberKnife look like now?
Well, the one way to look at it a little bit is like getting a suntan. You could go out and get suntan 5 hours one day and get a tan, or you could go out for an hour a day for 5 days.
That's true.
And it's a little easier on you. Well, the reason we had to do that was we weren't able to focus so much the treatment. Nowadays, we can focus, pinpoint, so you don't have to do that. You don't have to go out 5 days. You can actually go and do a much more intense dose, have it limited to the cancer or the bad area, and then, although we do treat benign areas too, so it's much easier, so you don't have to come in for near as many treatments. You don't have to do that five days of suntanning. You can actually...
Interesting.
Yeah.
Just show up for the one session and you guys can get rid of a lot more of the problem there.
And we're able to be more effective to a broader range of tumors doing that. So.
Well, and liver cancer is on the rise, so this is going to be more important for people to become aware about the dangers of liver cancer.
Yeah, and we don't know exactly, but the liver cancers divide into two types. There's primary tumors that begin in the liver, then there's tumors that spread to the liver, like
secondary sites.
Secondary, like colon cancer, breast cancer. But the primary liver cancer is related to hepatitis, and so if hepatitis is on the rise, we're going to see more primary.
Liver
since
cancer.
1960, I understand it has been increasing.
And CyberKnife will treat both primary and secondary liver cancer,
Definitely,
right?
Yeah, and we're part of a team. Some of them are appropriate to be removed by surgical oncology. Some can be ablated, and CyberKnife is a part of that team. And we get with the surgeons, medical oncologists, to decide which is appropriate for each patient.
And if someone has had hepatitis, or they think that they might be at risk, what do you think? What do you suggest to people?
Oh, I think they should be followed by a gastroenterologist, and they may want to be doing regular imaging to make sure they don't have a primary liver tumor.
Okay, good advice. Thank you so much,
Yes.
Dr. Shannon Cox. Thanks for being here. Austin CyberKnife is located on I-35 near the Del Seaton Medical Center at the University of Texas. Give them a call, 512-324-8060, or go to austincyberknife.com.